As an expecting mother, you want to have a healthy pregnancy, but there's always a chance things could get complicated. At Stamford Hospital, we have Fairfield County's only 24/7 high-risk obstetrics coverage, so we can do everything to prepare for that chance, from managing an existing medical condition to performing a cesarean section.
Sometimes the C-section is planned ahead of time. Sometimes we need to change plans at the very end, and if that's the case, 2 operating rooms are ready to go at a moment's notice.
I take care of moms and babies during the pregnancy when there are any complications that arise. You'd see us in the beginning trimester of pregnancy for screening for chromosomal abnormalities and other structural problems of the baby. And when you're around 20 weeks pregnant, where we look at all the different parts of the baby. If you came in and had a complication or high-risk pregnancy, what I would do is help you understand what's going on, help you understand the approach and the different options that you have as a patient, and support you in whatever decision you make.
I think initially I was very nervous because you don't really know what to expect. We pushed for over 2 hours and the baby got stuck. Ultimately, we did end up with a C-section, which was not exactly what we wanted, but I was confident in the decision that they made. Logan is eating a lot, he's gaining a lot, he's quickly outgrowing all his clothes, but he's doing great.
What I'm going to do is ask a few questions about the pregnancy and family history, and then give you information on some testing options that are available.
Stamford Hospital will also help determine if your pregnancy might be high risk early on through its genetic testing services.
We focus in the prenatal setting mainly upon genetic conditions that could affect a pregnancy, the management of a pregnancy, or a baby or a child early in life.
So congratulations.
At least half of pregnant moms I meet are over the age of 35. We're focusing upon a family history of birth defects, of intellectual disability, of autism, and then there are certain genetic conditions that a genetic counselor is really trained to look for the signs of in a family tree.
And do they both share the same mother?
It's a big part of taking your family tree, is also learning a bit about your ethnic background. We are uniquely trained to look for things that sometimes no one else will really think of. So the fact that Stamford Hospital offers that level of service is really critical.
There's nothing that I see that needs to be referred out to other centers.
If any complications do come up, Stamford doctors are always in close touch with the Neonatal Intensive Care Unit, which is qualified to provide expert, specialized care.
Ideally, as soon as there's a possibility of a baby coming to the NICU, we like to get involved.
With multiple births, there is a much higher likelihood that at some point you would be seeing me, either for guidance or for advice if you're hospitalized with a complication. But by default, twins are able to be considered a regular, nice, low-risk pregnancy, just twice the fun.
Make sure you bring them back to visit now. I will.
It's honestly a privilege to be involved in the process of people starting or expanding their families.
If you're going to have a baby, I recommend Stamford Hospital. They advocate for their patients. They answer all your questions. They educate me being a new mom. I couldn't imagine myself going anywhere else to have my child.